As the COVID-19 pandemic progresses, it's become clear that many survivors continue to experience health problems long after their initial infection, even if the infection was mild. Back in October, the World Health Organization defined this as post-COVID-19 condition or long COVID. I'm joined now by ABC-7 medical contributor Dr. Neha Sharma. She's medical director of the Hospitals of Providence, Northeast, and Horizon City. Dr. Sharma, always good to have you on. What exactly does long COVID mean?
It usually occurs in individuals around 3 months after a COVID infection, and it lasts at least 2 months, and it cannot be explained by any other diagnosis. And some common symptoms are fatigue, shortness of breath, cognitive dysfunction, and a variety of problems, including headaches, joint pain, rashes, and GI issues. And some serious complications include heart disease, kidney issues, and mental health disorders.
Now, a recent study has found around 1/3 of older adults with COVID-19 went on to develop new conditions. That's compared with roughly 1/5 of older adults who did not have COVID-19. What does this mean for the long run?
This data is very important because with over 400 million cases of COVID worldwide, even a modest risk of long-term complications will have a major impact on our healthcare systems. The study looked at the health insurance records of over 130,000 older adults in the United States. The participants were 65 years of age or older, and they had received the COVID-19 diagnosis before April 1st, 2020. The researchers found that 32% of the participants who had COVID in 2020 sought medical attention for a new or persistent condition. This is 11% higher than the comparison group from 2020. This data could not demonstrate causation, which is important, but it's a very important step in the right direction for future research.
Now, Dr. Sharma, I understand there was another study involving people with COVID-19 treated in U.S. Department of Veterans Affairs hospitals, and that found a wide variety of cardiac health conditions that persisted for up to a year after infection. So what is the significance of those findings?
This was a very large study that looked at cardiovascular outcomes in COVID patients 1 year after contracting the virus. And the results are very concerning. They found that COVID raised the risk of all ailments studied, including heart attacks, heart failure, cardiac arrest, arrhythmias, and blood clots in legs and your lungs. You're even at risk if your infection was mild, which was the concerning part. The research showed that about 4% of all COVID patients could expect to develop serious heart complications. Now, this figure may seem small, just 4%, but it becomes very significant when you multiply it by the millions of people with COVID in the US and globally. It stresses the importance of outpatient follow-up after getting COVID and not missing those prevention and screening appointments.
So what can we expect in terms on future research?
Lots of research is underway, but the big news actually today was that Cornell Medicine was awarded a $9.8 million grant from the NIH for research dedicated to understanding the complexities of long COVID. This is promising. The one-year NIH award is part of a federal initiative called Researching COVID to Enhance Recovery, also called RECOVER. It's a national effort to define, treat, and prevent long-term effects of COVID. So hopefully soon we'll find out more.
ABC-7 medical contributor Dr. Neha Sharma, as always, thank you for coming on.
Thank you.